In the last year, the pandemic has put the healthcare system across the country to the test. In rural areas, that additional impact is yet another blow to an already fragile balancing act in getting proper medical attention. In this three-part series, I took an in-depth look at the health system in the Upper Peninsula. From the obstacles of providing proper care to patients, a local program that is training the next generation of rural doctors, and a closer look at some of the talented doctors who are dedicated to making sure the unique needs of rural communities are met. Tonight, we begin with the unique challenges of rural healthcare and the obstacles in our community. The natural beauty of the Upper Peninsula makes it one of the most unique places on the planet. For many, the lure of the Upper Peninsula is large open spaces and seemingly limitless outdoor opportunities. Unfortunately, that also creates a physical obstacle in getting the proper health care when a medical issue arises.
There's patients that can't get to the physician because their snowmobile is broken down and they can't get to the road to get to their car to get here. So that's something that I've never had to think about in medicine before. And so seeing a patient like that really gets your mind working in different ways to say, how can I help this patient in a different way than I've ever had to think about it before?
That ability to focus on the unique needs of rural populations means a doctor or nurse has to be more flexible in how they provide care, as well as take on more responsibilities.
Being in a more rural community, we get to work with a lot of physicians that kind of have to do multiple different things. So they're not just focusing on one specialty, like the family physicians here in the UP focus on, like they do a lot of pediatrics, some will do some procedures just to try to help their patients not have to travel quite as far. So a lot of the providers that we work with, not just primary care, but specialties as well, they're doing a broader spectrum of care.
Beyond overcoming barriers by providing a broader set of services, rural areas also lack the personnel for specific types of medicine.
Primary care physicians are often the only physicians in the community. There are a lack of specialists in rural communities.
This lack of specialists also leads to situations where patients don't have the resources they need or must drive long distances to get any care at all. Nicole Bradshaw, who was the author of a study from the Citizens Research Council of Michigan, says 1/3 of medical school graduates were from rural areas, but now it is about 1/4. She went on to say that unless you have some sort of tie to a community or always intended to go into rural health, research shows most physicians are unlikely to practice in a rural area. A 2007 study from a nonprofit medical research organization found that only 10% of physicians practice in rural areas.
I did grow up in the Upper Peninsula, so I did see kind of those health disparities. We had to drive, 1, 2, 3 hours to get specialist care. I had never heard of a psychiatrist. I never had a pediatrician. It was always just, your basic family doctor.
Even though the Michigan State University College of Human Medicine UP campus finds passionate students who are interested in rural healthcare, another issue is the economic factors of healthcare. According to an article from MLive, national research suggests that a shortage of primary care can lower the quality of patient care even as it drives up costs.
Healthcare is like any other business. It relies on volume to be sustainable, right? So, it's very difficult if people can't access that.
An analysis by the American Academy of Family Physicians found that having one primary care physician for every 1,200 people is reasonable. In the United States, it is just over 1,300. In Michigan, it is close to 1,250. The Citizens Research Council found that the bottom 10 counties in Michigan are all rural counties that range from 3,000 people to a physician to nearly 7,500 people to one physician. If these trends continue, the shortage of rural primary care physicians in Michigan will get worse as older doctors continue to retire. Tomorrow night, we will continue to explore the challenges of healthcare with a look at a bright future for the UP. Join us as we share a local program that is helping train new doctors to deal with the unique challenges of rural health.